Welcome to this pharmacology quiz on tetracyclines, part of our ongoing pharmacology quiz series. In this video, we'll test key facts about tetracycline antibiotics and their use in managing conditions such as acne, respiratory infections, sexually transmitted infections, and atypical bacterial diseases. This quiz contains 10 recall-type multiple-choice questions designed to strengthen your understanding. Each question has 5 options, followed by the correct answer and a brief explanation. The video will pause for a few seconds after each question to give you time to choose your answer before the correct option is revealed. So, let's get right into it. Question 1. Which of the following statements about the mechanism of action of tetracyclines is most accurate? Option A. They irreversibly inhibit bacterial DNA gyrase. Option B. They block cell wall synthesis by binding penicillin-binding proteins. Option C. They bind the 50S ribosomal subunit and inhibit transpeptidation. Option D. They inhibit folate synthesis by blocking dihydroxyapatite synthase. Option E. They reversibly bind the 30S ribosomal subunit. The correct answer is Option E. They reversibly bind the 30S ribosomal subunit. This is because tetracyclines inhibit bacterial protein synthesis by reversibly binding to the 30S ribosomal subunit and preventing attachment of amino-acyl tRNA. All other options describe mechanisms of different antibiotic classes, such as fluoroquinolones, beta-lactams, macrolides, or sulfonamides. Question 2. Which of the following drugs is most commonly used for acne vulgaris because of anti-inflammatory effects? Option A. Minocycline. Option B. Doxycycline. Option C. Tetracycline. Option D. Oxytetracycline. Option E. Dimeclocycline. The correct answer is Option B. Doxycycline. The reason is that doxycycline is widely used for acne because of both antibacterial activity against Cutibacterium acnes and strong anti-inflammatory effects. All the other options are tetracyclines, but are less commonly used for acne due to dosing inconvenience or adverse effect profiles. Question 3. Which of the following drugs is preferred for Lyme disease due to its oral bioavailability and tissue penetration? Option A. Amoxicillin. Option B. Ciprofloxacin. Option C. Doxycycline. Option D. Azithromycin. Option E. Cefuroxime. The correct answer is Option C. Doxycycline. This occurs because doxycycline has excellent oral absorption, long half-life, and good tissue penetration, making it first line for Lyme disease. The other options are either alternatives, less effective, or belong to different classes not preferred as first-line therapy. Question 4. Which of the following statements about tetracyclines is incorrect? Option A. They can cause permanent tooth discoloration in children. Option B. They are contraindicated during pregnancy. Option C. They accumulate in developing bones and teeth. Option D. They are safe for use in infants under 6 months. Option E. They may cause photosensitivity reactions. The correct answer is Option D. They are safe for use in infants under 6 months. The explanation is that tetracyclines are contraindicated in infants and young children because they deposit in teeth and bones, causing discoloration and growth inhibition. All the other statements are well-known adverse effects or safety warnings associated with tetracyclines. Question 5. Which statement about tetracyclines and pharmacokinetics is most accurate? Option A. Food increases tetracycline absorption by enhancing solubility. Option B. Calcium salts increase oral bioavailability of tetracyclines. Option C. Doxycycline is mainly eliminated through hepatic routes. Option D. All tetracyclines are primarily cleared by renal excretion. Option E. Tetracyclines have poor tissue distribution. The correct answer is Option C. Doxycycline is mainly eliminated through hepatic routes. This is because doxycycline is largely excreted via the bile and feces, making it safer in renal impairment. All the other options are incorrect as food and divalent cations reduce absorption. Not all tetracyclines are renally cleared, and they have good tissue distribution. Question 6. Which of the following drugs is most associated with causing drug-induced diabetes insipidus? Option A, doxycycline. Option B, minocycline. Option C, tigecycline. Option D, demeclocycline. Option E, tetracycline. The correct answer is option D, demeclocycline. This is because demeclocycline interferes with antidiuretic hormone action in the renal tubules, producing nephrogenic diabetes insipidus. All the other options lack this specific pharmacological effect on renal water reabsorption. Question 7. Which of the following statements about tetracyclines is true, with all others being false? Option A. They are bactericidal against most susceptible organisms. Option B. They are ineffective against intracellular pathogens. Option C. They require oxygen-dependent transport into bacteria. Option D. They inhibit peptidoglycan cross-linking in cell walls. Option E. They are rapidly destroyed by gastric acid. The correct answer is option C. They require oxygen-dependent transport into bacteria. The explanation is that tetracyclines enter bacteria through an oxygen-dependent active transport mechanism, which limits activity against anaerobes. All other options are incorrect because tetracyclines are bacteriostatic, effective against intracellular organisms, do not inhibit cell walls, and are not rapidly destroyed by gastric acid. Question 8. Which drug is preferred over tetracyclines in pregnancy for treatment of chlamydial infections? Option A, azithromycin. Option B, doxycycline. Option C, tetracycline. Option D, minocycline. Option E, tigecycline. The correct answer is option A, azithromycin. This is because azithromycin is considered safe in pregnancy and is recommended for treating chlamydial infections. All the other options are tetracycline derivatives, which are contraindicated during pregnancy due to effects on fetal bones and teeth. Question 9. Which statement about minocycline compared with doxycycline is most accurate? Option A. Minocycline has poorer central nervous system penetration. Option B. Minocycline causes more vestibular adverse effects. Option C. Minocycline is eliminated primarily by the kidneys. Option D. Minocycline has lower lipid solubility. Option E. Minocycline is inactive against staphylococci. The correct answer is option B. Minocycline causes more vestibular adverse effects. The reason is that minocycline is highly lipid-soluble and penetrates the central nervous system, leading to dizziness and vestibular toxicity. All other options are incorrect because minocycline has good CNS penetration, is not primarily renally eliminated, is highly lipid-soluble, and is active against staphylococci. Question 10. Which of the following statements about tetracyclines is true, all others being false? Option A. They should be taken with antacids to enhance absorption. Option B. They are effective against many atypical organisms. Option C. They are the drugs of choice for bacterial meningitis. Option D. They have no effect on the gastrointestinal flora. Option E. They are safe during tooth development. The correct answer is option B. They are effective against many atypical organisms. This occurs because tetracyclines are active against organisms such as chlamydia, mycoplasma, rickettsia, and other intracellular pathogens. All other options are incorrect as antacids reduce absorption. They are not first line for meningitis. They do affect gut flora, and they are unsafe during tooth development. The quiz is now complete, and thank you for taking part in this tetracyclines challenge. Don't forget to drop your score in the comments so I can see how you performed. For deeper understanding, review Katsung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, as guideline references in this video are aligned with the BNF. These trusted resources will help strengthen your clinical reasoning and pharmacology knowledge. Subscribe to the channel for more quizzes and focused pharmacology learning.